Okay, go ahead.
Well, good afternoon, Malika, and to everyone on this wonderful call today. My name is Dr. Gloria Morrow. I am a clinical psychologist, and I am also the Director of Behavioral Health for Unicare Community Health Center. We have 13 clinics in Southern California, and I manage our behavioral health teams for integrated care in our clinics. Um, Before I get started, I don't want to begin without expressing my deep, heartfelt sympathy for the victims of the past few weekends where we've had those mass killings and shootings. And I know that we may not know those folks firsthand, but which is very appropriate for our topic today. We all have compassion. And so I know if you are feeling anything like I'm feeling right now, there's a sense of community grief that we all are going through right now because of what has happened. So I want you all to know that I acknowledge that and honor each of you for being on the call today in spite of everything that is happening in our world. So I must say, take care of yourselves, and I'm going to be talking a little bit more about self-care as we get into our presentation. One of the things that makes this presentation so very exciting to me is there are so many people who do wonderful work caring for others in a plethora of capacities and different ways. And so we know that it's easy for some of us to just care. It really is our calling in many times. And so I know that many people come to see me, however, after they have cared so much until they are out of gas. And there's a name for that, and we call it compassion fatigue. Originally, we used to think about compassion fatigue as it related to first responders or, firefighters, police officers, people who had to go to horrific scenes like we saw over the weekend. And we used to kind of use that terminology to express some concern for people who were constantly bombarded by trauma and tragedy. But we are watching in live time, in real time, so many different tragedies. And then in the work we do, we are faced with so many opportunities to feel fatigued and really exhausted because of the constant, nonstop way we have to address people's needs. So this topic today, I believe, is very important, and I'm so glad that LA Best Babies decided that this is something they wanted to have for you today. So I've welcomed you and introduced myself to you. I want you to know that we are going to try to capture 5 different areas today. First, I would like to introduce you to what constitutes compassion fatigue and who is at risk of developing it. The second thing that I hope we are able to focus on is kind of looking at the impact of compassion fatigue on one's mental, physical, social, and spiritual health, as well as those they serve. Because you've heard the old adage, broken people can break people. So if we are not doing well, then it will impact the people we serve. Third, participants will learn the major causes of compassion fatigue. Fourth, we are going to be introduced to what I consider culturally responsive strategies for preventing and overcoming compassion fatigue, as well as developing self-compassion. Because people have to do that in ways that is culturally responsive for them, because if not, then we're just trying to fit everybody in one box. And so we know that people have different ways of processing. They have different ways of experiencing, their own health and making sure that they're taking care of themselves. So we want to honor that today. And then lastly, we want to learn some culturally responsive strategies for helping the people you're serving to develop more self-compassion. And I believe in the work that you do in helping mothers who are new mothers and having babies that sometimes may be well or not well, or sometimes the mothers may have some challenges themselves. It is important for them to be able to learn some of the strategies for self-compassion. If you look at my image, we are looking at a lot of stress today, and it affects our mind, body, emotions, and behaviors. And so we know that it's so important for us to spend time talking about ways for us to do the good work we do and yet be healthy in the process. So when we think about compassion fatigue, and I love this quote from Riemann, it says the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. So all of us are going to experience some type of compassion fatigue in our lifetime because we're not going to be able to do the work we do and not be touched by it. So that's the first thing I want you to know about compassion fatigue. So when we define it, it is defined as a state of exhaustion and dysfunction, and that can be biologically, psychologically, and socially because of this prolonged exposure to secondary trauma or a single intensive event. So if you're on the scene of a crime, or if you're at a disaster, or you are in the hospital and a baby doesn't make it, well, that is one of those single intensive events they're talking about. But if you are just hearing the stories of people who have experienced a lot of trauma and a lot of trouble in their lives, that can also affect you. So when we think about compassion fatigue, it's also a series of psychosocial and emotional factors that are caused by a specific event or events, both indirectly and directly, which can then affect helpers. Also, it can be this emotional fallout from delivering services to those who are primarily traumatized. And I think I can say with pretty much safety that we are dealing with traumatized communities all the time. We're dealing with homeless people. We're dealing with people coming from very low income. And we're dealing with people who have suffered a lot of trauma. And then compassion fatigue is often described as the cost of caring, and especially for those people who are experiencing emotional and physical pain. And this is very appropriate to those of us who are working in hospital settings or even volunteering with parents who are just bringing children into the world. There's just a lot of trauma and different types of emotional and physical pain that they are experiencing. And when we care, then it is a cost for us to care. Compassion fatigue is a state experienced by those helping people or even animals in distress. It is an extreme state of tension and preoccupation with the suffering of those being helped to the degree that it can create a secondary traumatic stress for the helper. And I know we didn't think about this, but again, day in and day out, we're trying to help people who are in distress, and we walk away with what's called secondary traumatic stress. So when we look at this process, and this is the compassion fatigue process by Figley, and it's really pretty dynamic if you look at it. So if you look at the one where you're exposed to the suffering, and then look at 2, because then we start developing concern. And then 3 is the empathic ability. And I have to say this, not everybody has the ability to be empathic. And they will if they develop it, but sometimes people don't have it. So this would be for people who do have the ability and the willingness to be empathic. That generates the suffering, the concern, and the ability then generates an empathic response. And people can do one of two things. Either they can detach, from what's going on because they have to do it so often until they've developed a coping mechanism, or they can feel a complete sense of satisfaction because they are responding to someone in need. That leads to residual compassion stress because now I'm locked in. I'm either detaching myself or I'm really engaged in the process. And so then we go from there to prolonged exposure to that suffering, which can happen if you're working with the same clients over time and we're hearing the same stories, and also picking up on their traumatic memories and our other life demands that we all have to deal with. All of that leads to compassion fatigue. So when we go into a room and work with someone and they are telling us these horrific stories about their lives and the suffering that they have encountered, and we hear that day in and day out, and we go into situations where there is a lot of trauma, we end up all the way to the process and through the process, leading us to compassion fatigue. And so who is really affected? And I kind of mentioned earlier when I talked about firefighters and some of the people, law enforcement, EMS, healthcare professionals, volunteers, people who are first responders can all be at-risk professions for compassion fatigue. I want to turn our attention now to some of the symptoms and the impact of compassion fatigue, because I don't think we quite realize what's going on when we're feeling some of these symptoms. A lot of us are, kind of thinking it has to do with other things, and it may be that those other things can contribute to how we feel. But just because of the work we do, we can experience some of these symptoms. And so there are symptoms that are very similar to PTSD, but they are coming now from secondary exposure. I don't know about you, but over the weekend, when I learned that there was one shooting and then woke up the next morning and there was another shooting, I began to feel quite anxious. It really got to me. And while I wasn't there on the scene, I was experiencing some of the trauma that was going on. And then my stress really became elevated because now I start worrying about, well, if I go to a mall today, which was my plan, am I going to need to look out? So you'll find yourself, if you are in a mall or you are in an outdoor big activity, big event, and you hear even a balloon pop, you're jumping because now you may be a little bit more heightened in your area of anxiety because of what you experienced over the weekend by watching the media. Well, similarly, these things can happen to us when we are sitting with people and talking to them who have this exposure to trauma for many, many years, and those that are coming to see us continually. It just adds to it. Sometimes we can become very cynical, discouraged, or even hopeless about work and our career because we don't know what to do with all of those feelings we are experiencing. Paradoxically, sometimes we find it difficult to leave work at the end of the day because, we're just constantly working in the same area all the time and not taking a break and not moving away from it because we feel like we have to be the one to solve every problem. So when you're having a hard time leaving the job or leaving work at work, sometimes that is a warning sign that says that you may be a candidate for compassion fatigue. And then sometimes, how many of you have had these reoccurring thoughts about a particular case or patient or client you've been working with? You just can't shake it. It's just in your head. And so those are warning signs that we have to pay attention to. Now, there are some symptoms, and these symptoms, this is really good for us to see because We go from cognitive to emotional to behavioral, spiritual, personal relationships, physical, somatic, and work performance. And I'm just going to read a couple of these for you. When we think about cognition, we can have lowered concentration. There may be a sense of apathy that sets in. Sometimes we can just be preoccupied with trauma. That's why I had to turn my news off, because I was finding myself preoccupied with what happened over the weekend. I was just watching and watching and watching and trying to see what I can do to respond. And so if we're preoccupied, then that's going to lead us to some of the other symptoms that we talked about. With regards to emotional, sometimes we have a great sense of anxiety and feeling of helplessness and powerlessness. When you're given a directive by your agency to do things in a certain way, and then, you feel like the clients that you're serving, there's no way they can meet those expectations because of all the barriers. Sometimes we feel really powerless. And again, going back to the weekend, some of us feel powerless because we either weren't there, or even if we were there, there was nothing we could do about it. That's where we find guilt and anger, and sometimes that anger can lead to rage. We can shut down and feel sad and depressed. Our emotions can be all over the place when we're dealing with compassion fatigue. And then behaviorally, we can be withdrawn, things we once enjoyed, we don't want to do those things anymore. We can be very irritable, and I see that a lot, where people are very snappy and irritable when they're feeling that fatigue. And then I see people also who tell me they can't sleep. And when they do sleep, they're dealing with night terrors, or they're dealing with nightmares or other kinds of behavioral responses to what they've experienced. And then spiritually, and this particular section I'm presenting with respect to all faith and non-faith, religious traditions and non-religious traditions, whatever your sense of meaning is and where that comes from, sometimes it can be hindered or halted because of that compassion fatigue that has come upon you, where you feel helpless and hopeless, and you start questioning even your spiritual life. And then personal relationships, we see a lot of people having relationship issues with their spouses and partners when they're dealing with compassion fatigue. Sometimes they just withdraw from communicating with others, feeling isolated, and have a blaming attitude because they're dealing with that pain and they don't know what to do with it. When we look at the physical somatic, we can have rapid heartbeat, very much like panic attacks. There can be dizziness. We can have, many trips to the doctor, to the ER, and when we go, they find that there's nothing physically wrong, but because we're so, exhausted and tired because of the trauma we experience on a daily basis, it's beginning to manifest itself physically. And then, of course, the last one is our work performance. Sometimes we have very low morale, low motivation. We just don't feel appreciated at work. We feel like there are many conflicts at work between staff. People are not getting along well, and that can be because of the work you're doing without having some balance to your life, and also having some strategies for overcoming this compassion fatigue. First of all, we have to acknowledge what it is. And then once that happens, then we can start looking for solutions to help us with the work that we really love to do. So I love cartoons, and this is one of those that has so much meaning, because when you look at this gentleman, he looks like the epitome of exhaustion. He says, C. Figley says, we have not been directly exposed to the trauma scene, but we hear the story told with such intensity, or we hear similar stories so often, or we have the gift and curse of extreme empathy and we suffer. We feel the feelings of our clients. We experience their fears. We dream their dreams. Eventually, we lose a certain spark of optimism, humor, and hope. We tire. We aren't sick, but we aren't ourselves. If you could raise your hand, how many of you can relate to this particular statement? We aren't sick, but we aren't ourselves. And that's how compassion fatigue impacts us. It doesn't stop us from doing what we do. It stops us from feeling well. And so that's why it's so important for us to be having this discussion on today. It can affect many dimensions of your well-being, and we talked about sleep disturbance a little earlier, your nervous system arousal, emotional intensity can increase, and then our cognitive ability can decrease. So if you're finding yourself having memory lapses or feeling scattered in your thinking, the words just won't come out, sometimes that's compassion fatigue. Sometimes people can have isolation and loss of morale and loss of hope and meaning, which equals existential despair. It really is important for us to understand how critical compassion fatigue is on us and our well-being so that we can address it and do something about it. So I know we've heard the term burnout, and so I wanted to make a distinction between the two so you would understand the difference between burnout and compassion fatigue. So when we talk about burnout, we're thinking about exhaustion of physical or emotional strength or motivation, usually as a result of prolonged stress or frustration. And so we know how that feels. It's a gradual buildup to a breaking point. And the stress and frustration can come from all kinds of work-related stress. It could be the stress of working with the persons you work with as your clients or patients. It can be stress because of a supervisor. It can be stress because of relationships between coworkers. It can be stress just because of institutional barriers that are there that you just can't do anything about. So burnout can come for a lot of different reasons. And it usually takes longer, doesn't just happen overnight. Now, we know that compassion fatigue may contribute to burnout, but typically these are two different animals. When we have paperwork and red tape, bureaucratic issues, I'm dealing with that right now. I'm also a clinician at my agency, so I see patients a couple of days a week. And the worst thing of all is to get behind in your charting, because now you've got a lot of paperwork. And when you're expected to see so many people in a day, and then you still have to complete your charts, it can be overwhelming. So we become frustrated and sometimes feel a little burned out when we have a lot of paperwork and red tape issues. Sometimes our home life, the environment at home and the environment at work can definitely contribute to your burnout. If you're not doing well at home and you're not doing well at work, that's a lethal combination because you're not going to function well. Sometimes, again, as I said, colleagues and the pace and or grind of work, all of these are frustrations that contribute to burnout. So let's look at the difference. And let's ask ourselves this question: do I love my job? If you say, yes, I love my job, I could do it without pay, it's something I know I'm called to do, but yet it is still difficult and tiring, and I feel frustrated at times, but I love it. That means you have compassion fatigue. But when the answer to the question is no, I don't love my job anymore. I wish I was working somewhere else, doing something else. I just wish I was out of here. That means that person is more than likely very burned out. So when we think about who is more likely to develop that compassion fatigue, and that's the people who say, I love my job, I want to do it, I want to be here, I want to help others. Anybody with the capacity for true compassion, empathy, concern, and caring are candidates for compassion fatigue. That means many of us who are breathing, who get up in the morning and want to go do good work in the community or do good work in the hospital or good work to help hurting and broken people or to make sure that babies are with healthy parents and that babies are healthy. That would be you. And that means that you are capable of suffering from compassion fatigue. Also, when we try to stay within professional boundaries and adhere to training guidelines, we're going to be people who suffer because sometimes those guidelines are difficult for us to manage because they sometimes go against our core beliefs. But when we're trying to do that, we love our job, we don't want to leave, but here are some boundaries and training guidelines that I must adhere to that make this really difficult. And also the greatest strength, our compassionate connection, can also be our greatest vulnerability. So some of us who have the potential for compassion fatigue, it's because our greatest strength to be compassionate can also be our greatest vulnerability because we don't know how to set appropriate boundaries and we don't know how to make sure we're keeping ourselves healthy in the process. And then not a characteristic to give up. Those are people who say, I'm not giving up. I'm in here for life. This is what I've been called to do. I'm going to do it no matter what. And so those are folks that are more likely to develop compassion fatigue. So let's look at some prevention and treatment. And I want to, before I move on, I know I can't see you or hear you, but if you have any comments or even questions, if it's okay with our organizer, you can just type that in so that I could try to address things that you may be thinking as we're going along. Somehow that'll help you to be more interactive with me. But if not, that's fine. I'll keep talking. But I want you to know I really welcome you being able to do that. So prevention and treatment, let's look at what we need to do. Early recognition and awareness is always the key, as with anything. The sooner we understand and know what's going on with ourselves, the better. And so one way to prevent ourselves, for those of you who don't believe you're there yet, is to restore a healthy balance in your life, which must include good sleep. Now, how many hours of sleep do we need a night? Now, I know some people debate this and say, well, that's different for different people, but we're hoping that people can get anywhere from 6 to 8 hours of sleep each night, because that way you have a chance to let your brain wind down and your body to rest and be restored. Good nutrition and exercise go hand in hand with that. So if we're getting enough sleep, if we're getting good nutrition, and we are exercising, we're going to be creating a healthy balance for our lives. Then the next one, and if there are any managers or supervisors in the room, please forgive me for saying this, but we need to take some time off from work. You know, we can't go to Rome or Paris or other outlandish, beautiful, exotic places, but we need to take some mini vacations frequently so that you give yourself a chance to power down and then power back up in a healthy way. We go from day to day without taking a break, and then we are caring for people in our workplace, and then we're caring for people when we get home. And the cost of caring is enormous. Then we must enhance our skills by attending stress reduction classes or learning how to utilize mindfulness techniques, and we'll talk a little bit more about that in a little bit. But there are some things we can do to get better and feel better. And then just to have enhanced self-care skills. because if you don't care for yourselves, you cannot care properly for others. And for some of those of us who have already begun to move into the area of compassion fatigue, and you know it, then sometimes we need to get medical treatment for those symptoms that may be interfering with your daily functioning. And I mentioned some of those things when I gave you that nice chart that have all of those different areas that we can be impacted. And then implement, again, those regular mini escapes in your life. We've got to have some recreational time, creative therapies, or other healthy diversions from the intensity of your work can be very important. Let me tell you what I do. I have a beach chair in my car, and I don't live by the beach. I live in the Inland Empire where it's 102 degrees today. But when I want to relax, I have that beach chair in my car. I will head to the beach or the lake or somewhere and just sit and have time for me in my space. And we have to create a space of peace for ourselves, because if we don't, no one else will do that for you. If you have children, they'll be knocking on the door. If you go in the bathroom, they're knocking on the door so that they can get in there to be with you. And that's your only little place of peace. So you've got to find a place of peace for yourself so that you can replenish and refuel. Don't medicate with drugs or alcohol. It's important for us to not utilize these types of substances that will create further problems for us. When you're dealing with compassion fatigue, sometimes all you want to do is get home and have a glass of wine. But let me remind everybody, you know what we used to think a glass of wine is? That's really 2 glasses of wine. That wine should only come up to half of the glass. And many of us are drinking 2 full glasses of wine at night, which means you're drinking 4 glasses of wine. So it's important for us to stop over-medicating or self-medicating with drugs or alcohol when we're feeling some of these symptoms, or we're feeling just totally overwhelmed and frustrated. So we know that we are resilient. It is important for us to utilize that resilience, because there will be times in our lives when, we are going to face some tragedies and traumas of our own. So not only will we be dealing with things that happen at work, we'll be dealing with things that happen in our own lives. So in order to deal with that, we must be well rested. Resiliency can sag when you are tired. It's hard to be resilient, to have the ability to keep on going when the going gets tough. The only way you can do that is to be rested, and then to utilize your positive, supportive connections to process your feelings. It's amazing to me, those of us who are in the helping professions, we typically talk to other people or process our feelings less often than the general population. So we've got to believe that there has to be somebody who's positive and supportive in my circle that I can talk to when I need to process my feelings. And if they are not there, guess what? You may need to start eliminating some people who are negative so that you can get people in your life who are more positive, who will help you during your time of need, and then you can in turn be helpful to them. We must take negatives and turn them into positives. I've been wrecking my brain with that idea as I was preparing all weekend. How in the world do you take the negative things that happened over this weekend and turn them into positives? Well, I did find one thing that I saw that might be able to fit into the positive category, and that is we are talking. And not only are we talking, we are developing action plans. And that is how you can turn negative into positive, where you see yourself not as part of the problem, but part of the solution. That helps us to feel rejuvenated and energized when we are able to see something that was so bad turn into something so good. The research shows that those who can turn off thoughts about work, are more resilient during their careers. So what that means is when you leave your workspace in any given day, you should be changing your focus. It's almost like changing your clothes or putting on a different hat when you walk out. I don't know about you, but I'm a music lover. So when I get into my car, and this is after talking to people who are suicidal, sometimes talking of harming others, who are dealing with severe depression and anxiety and PTSD, and I deal with that those days that I see patients, and then the days I don't see patients, I'm dealing with it with my staff. So the way I get through it is I turn off thoughts about work. When I've made a conscious decision, when I walk out that door, I have done everything possible to address the needs in my workplace while I was there. I can do nothing else now. So I have to turn off and I have to take on my new attitude as I go out into the world, because now I have to make sure that I'm healthy and whole for my family. And if I don't turn off the things that are happening at work, then I'm going to drag that home, and then my family is going to suffer, and then so will I. So if you want to stay really in a great place in your work, you must learn how to turn off thoughts about work and become more resilient during your career. You need to have good support. There needs to be people in your workplace where you can talk about things when there is a hard day for you, where you have to deal with a lot of trauma and people who are going through things, and you've had to make tough decisions. You know, sometimes you all have to make tough decisions. And so when that happens, you need to be able to process and talk about it. Now, I'm not talking about over-process it, because sometimes we continue to talk and talk and talk about things, and then that just keeps it alive for us. So you have to be able to process your thoughts and feelings with someone who is healthy enough for you to do that with, and then be able to disconnect work and home and keep these strong connections with others. So I'm going to just take a 2 to 3 minute time here. If anyone has any questions, I've kind of wrapped up compassion fatigue in terms of the problems that are associated with it, how it can impact our lives, and some of the things that we need to do to address it early on so that we do not have to suffer from compassion fatigue at all. And then if we are suffering, then there are some treatment strategies that were listed for you. So does anyone want to send me a little message or any thoughts you have about just compassion fatigue? Because we're going to move now into self-compassion. Any thoughts? And I'll take a breath and you can type away if you'd like, so I know you're there. If you have any questions or comments, or even a little example of what we've been talking about, this is the time to do it.
We have a question from Fatima in the chat box.
Yes, I'm ready. What's your question?
Oh, so it's, how is it different from vicarious trauma?
Well, vicarious trauma, you have a little different experience. And I want to ask someone, if you can tell us if you'd like to, what is your definition of vicarious trauma?
So everyone is muted right now, so I can unmute everyone, but there are 44 people on the line, so I don't want there to be too much background noise. So if you can answer it in the chat box.
Okay. Well, can she hear me though? She can hear me, right?
Yes.
Okay. All right. Then we'll do it this way. When we think about vicarious trauma, it really has to do with transforming the self of a trauma worker. And it can result because of that empathic engagement with traumatized clients. So it's very close to what we're talking about, except if we're not there on the scene, we are tending now to call it traumatic stress rather than calling it vicarious trauma. When we think about vicarious trauma, it's like this special form of countertransference where you're really taking it on, And so people who are just exposed, they may not take it on, they're just impacted because they care. But people with vicarious trauma, they take it on as their own. And it may be because they have experienced trauma themselves of the same nature. And that may cause them to have a different result as they're going through it. I hope that helps you. Anyone else have a question? Okay, well, keep them coming. If you have questions, you can ask them. The reason I asked what her definition was is because we do get the two mixed up. We do believe that traumatic stress, which is the one I'm really speaking about when I talk about you as the worker just being exposed to trauma, is very different from the person who really takes it on as their trauma. And so we have to make sure that we are healthy when we are in these working environments. Because if you don't do your own work, it's very easy for you to take on the countertransference of that trauma onto yourself, because now you're reliving your own experience. So the thing that's most important here is that we learn how to exercise self-compassion. And when I think about self-compassion, it's really simple. It's providing an opportunity for me to care about myself in a way that insulates me when I go into my work. So I have to do some things in order to make that happen. Many of us are trying to help people out of a glass, and I want you to envision with me a glass of water. The glass is full to the top, and in that glass are nutrients that you need for your health and well-being. Everything in that glass of water is necessary for your life. And what we typically do, we are giving to others out of that glass of nutrients in that water. So what happens, we end up depleted, because keep in mind, you need everything in that glass for your own sustenance. But because you're giving out of that glass to others, you are now depleted. So the only way that you can give to people and share and support and have compassion in a real way, in a healthy way, is to make sure you're continuing to pour into your glass of water those nutrients so that you create an overflow. Can you imagine this glass now overflowing with water that has nutrients in it? Well, that's what you have to give to other people. You have to give out of your overflow. You can't give them what you need to live. And so that's where self-compassion comes in. When we think about self-compassion, it is the ability to be able to show empathy, love, and concern for yourself. We can be compassionate to other people all day long, but we find it sometimes very difficult to care for ourselves. And this isn't just at work. This is at home too. Some of us are, taking care of our families, doing everything for everybody and not doing very much for ourselves. And so we come to work already drained, and then our work is draining, and we are very, very at risk of developing compassion fatigue. So we have to do some things for ourselves. and there is an art and science of caring for others without forgetting self-care. So we want to just share a couple of these with you. Number one, using a journal. And remember I said culturally responsive. People do different things. So writing may be one thing to do. Using music and art and other forms of entertainment may be your way of expressing your feelings. So you may like to write poetry. You may like to write letters. You may like to draw, play music, write music. All kinds of things are available for us that are culturally responsive to who we are. And we can use those different things to help ourselves to take care of ourselves. There's a ritual at the end of each day that we need to have to transition into your life outside of work. So that way you can leave some of the stress that you have experienced in the workplace. You can leave it in the workplace. And I have that ritual. Remember, I go outside that door. I put on my music. I don't care what's going on. I don't take phone calls. I don't do anything other than just relax my mind. And music is one of the ways I do that. And so I'll put my music on, I'll sing, I'll hum, I'll just rock. I'll have a really good time on my way home. So by the time I get home, I'm ready to face my family. What I used to do is ask for just a 30-minute break when I got home, just to decompress and to de-stress. And I would go and do yoga or do some type of other activity. Sometimes it's just prayer or other things that are good for me so that I can get myself in a good space to be able to work with my family and to kind of shed some of the things that happened in the day. Also, when we have good relationships with our colleagues, where we can have a good confidential discussions about things that are bothering us about work, and I'm not talking about you complaining about your boss or any of those things, because there are processes in place for that. But sometimes you want to talk about a case, and nobody at home should hear about that anyway because it's confidential, and that will be a perfect place to do it. Everybody needs a mentor, a supervisor that they can trust, a therapist that you can go to be able to discuss things that you can't discuss at home. So it would be very good for you to develop some of those relationships so you would have support whenever you need it. And then be kind to yourself. I think sometimes we can be our own worst enemy. We must refrain from harsh criticism. We have some folks who are perfectionistic, and when they are doing a task or doing something, they can be so hard on themselves. That's a setup for compassion fatigue. We must give ourselves permission to be human with the potential to fail and make mistakes. I can't tell you all how important this is to you exercising self-compassion, because we all will make mistakes, and we should see the beauty in mistakes. And here's the problem. If you don't see the beauty in mistakes, whenever we make them, we'll continue to make them because we will just gloss over them, not pay attention to them, and not try to make any corrections. But when you can say, you know what, I wish I had done something differently, let me see what I can do to prevent that from happening next time, that helps me to not make the same mistake. Now, I may make some mistakes, but not the same ones. Then we must believe that we are worthy of making ourselves a priority. I just want you to say to yourself right now, I am worthy of making me a priority. I can't hear you. Say it again. I am worthy of making myself a priority. You've got to say that to yourself because nobody else will. If you don't see yourself as a priority, people will always dump on you. They will always take advantage of your kindness and your caring. So you have to make sure that you are taking some time off. You're taking your lunch break. If you do nothing more than walk around the building, you need to get out of there, because if you're sitting there, inevitably somebody's going to come to you and ask you a question. And because you don't want to turn that person away, you will stop and respond to that question. So you're not taking care of yourself. You're not getting the breaks that you're supposed to get in the daytime. And then at nighttime, and this is for those who work in daytime, because this could be the same thing if you're working nights. But then when you get home, the same thing must apply. You must be able to allow people in your household to all pull their fair weight in the house. So that way you don't work all day and then have to work all night. Now, I know I'm treading on some fine areas right now. So I'm not trying to get folks divorced or separated. I'm not. But I am saying that if we don't learn how to see ourselves as worthy and make ourselves a priority, we're never going to exercise true self-care. And so when we think about ourselves, we kind of talked about things that we can do for others, for ourselves. Now let's look at some things that we can teach the people we're serving. Number one, we've got to be a good example. If we don't exercise good self-care, then we can't teach anybody else that skill. We have to make sure that we're doing it and being a good example. Then secondly, we want to be able to give good self-affirmations. And this is something that you can work with your clients or patients or whatever you consider them. You can help them to start writing down some positive things about themselves. And some of you are probably already doing this, because when you hear people talk so negatively about themselves because of mistakes they've made or because of trauma that they've experienced, they're not going to be in good condition to care for their children. So let's teach them how to feel good about themselves and to decide on some things they know about themselves that are positive. And then you help them by showing them some of the things that you see that's positive about them to help them to develop it. Sometimes we have to help people until they see things for themselves. Then we must teach our clients, and this is for us too, to set appropriate boundaries. You have to teach people how to say no. And that's a hard thing to do, but we have to learn how to say no and not now. And we have to teach our clients those boundaries that need to be set, because a lot of times they don't know. Everything is blurred. And so you are a great teacher to them. You have to teach them to be able to strike a balance. There needs to be a balance. Even for those who are very spiritual, sometimes, we can kind of hide under our spirituality. I was just sharing with our organizer, we just lost a 3-year-old to a drowning, one of my son's friends. And the family is being really, really strong. But I'm concerned because I haven't seen them have any emotions other than just talk about their faith in God. And I believe, I'm a Christian, and I believe that that is certainly something that can happen. But at the same time, if you aren't allowing yourself to experience and process your feelings, I'm wondering if down the line there's going to be something that triggers them where they may not be doing as well. So we have to learn how to strike a balance. We have to learn how to play. I don't know if you all understand what I mean by play, but when we were younger, we used to play. And sometimes we need to just go back to our playful, youthful self and do some things that we need to do to help us to strike a balance in our lives. It cannot be all work and no play. And then deep breathing, using some of the mindfulness techniques of learning how to inhale and exhale and connect with your environment in a way that's healthy. We have to teach clients. That's something that's simple, that is very easy for them to do. When I'm working with my patients and I teach them how to breathe, that is just a wonderful gift for them, because they are now able to release themselves and to relax their muscles and to feel much better. Then we must help our clients and patients to develop positive role models and mentors. And they must know how to identify them. And somehow you may be the person or persons who will help them to identify those positive role models and mentors, because they need to have positive people around them. You are a positive person around them, but they need others who are saying the same things you are saying, because that will reinforce what you're trying to impart to them so they can do better as a parent and being able to take care of their children. And then we have to teach them how to forgive, and just use that as a wonderful technique for helping people to be able to care for themselves. If they're harboring unforgiveness, it's kind of like drinking poison, expecting the other person to die. When you are filled with anger and resentment, then that causes people to not be well. And so a good sign that a person is exercising good self-care, they are able to forgive people who have hurt them. But most of all, they're able to forgive themselves. There are people that you're working with that are really shamed and feeling guilty because of things they have not done well and right when they were carrying their children. They have not had an opportunity to feel okay about where they are in their lives. And so we have to teach them how to forgive themselves, because if you can't forgive yourself, you will not be able to love yourself. So we want them to love themselves, then we must teach them how to forgive themselves. And if any of you are listening and you know what I'm talking about, that would go for you as well. So we come to the place where we need to take time to smell the roses. And so if you are depressed, you are living in the past. And I need to get some water. You guys give me 1 minute. Okay, I'm back. Thank you. I thought I brought my water bottle in, but I didn't. If you are depressed, you are living in the past. If you are anxious, you are living in the future. If you are at peace, you are very possibly living in the moment. And we want to teach not only the people we're serving, but ourselves how to do more living in the moment. If we're going to be healthy and exercise self-care, we've got to be okay to live in the moment. And, you know, there's never a more important time than this for us to exercise this, because as we see in our world, you know, we could be very anxious if we decide to live in what's going to happen. We could be very depressed if we decide to live in what just happened. But today we are here, we are experiencing life in this very moment. And so we have to learn how to be at peace in the very moment we have. And so we want to teach that as well to the people we're serving. So in conclusion, I want you to know that unrecognized and untreated compassion fatigue causes people to, number one, leave their professions, and sometimes they get involved with drugs and alcohol as a form of self-medicating. And sometimes on those extreme examples, they could even become suicidal or self-destructive. And so we know the importance of us being there for each other. You know, I used to say this years ago, and it didn't have a lot of research background at the time. but we do know that we are our brother and sister's keepers. So we have to watch out for each other. And when we are in the workplace, we should be so connected to one another until, we can look at each other and know that something isn't right, or that that person just needs to be able to talk and process some things. When things happen in the hospital and you know that your colleague is going to be suffering because of what happened, it's a really good thing. And I know you all do that. I can already tell because of where you work and what you do that you would be very, very, very anxious to help in any situation. So we have to watch out for each other. And if you see a colleague in distress, reach out to them, because it's very important for you to find a way to help people when they are in need, and then to ask for help if you yourself needs help. So I don't know how we could do this, but this was my Q&A time. So is there a possibility of us having some comments or opening up, or having people just write their thoughts down so that we could, sort of wrap up that way? I'm open to suggestions.
So if anyone has any questions for Dr. Gloria, I think we can put them in the chat box. I think that would be the right way to do it.
All right.
So if anyone has questions, now is your time. Anyone have questions?
Well, if not, I just want to say again, thank you so much for this opportunity to share. This is the kind of presentation I really like to do hands-on, because I do believe there's value in hearing people's stories and kind of seeing where people are as it relates to compassion fatigue and different things people do for self-compassion. But I'm so grateful we've had this opportunity. And so people can get my email from you, and if they would like to ask a question or to learn more, they can feel free to reach out to me. And I think that's all we can do today.
All right. Thank you so much, Dr. Gloria. So yes, if anyone has questions for her that come up later, please email me and I can pass it along. This session has been recorded. We will have a blog post on our Stronger Families blog, so I'll send out notes and a link to that as well, along with some other resources that as we compile them. So if you have any questions, again, email me, and otherwise we're going to end a little early today. Thank you for your attention, and we will talk to you next time.
Thank
you, everyone.
Okay, bye.
Bye.